It's nefarious, man. Like, the brain works in fucked up ways.
The mind is one of the most deceiving, manipulative pieces of equipment, flesh, human bodies on Earth. I never have trusted my brain.
All of that weight lives in your head, and you are the decision maker.
Psychology of entrepreneurship.
Hi, it's Ronsley. If this is your first volume, welcome. This is a weekly series where I go inside the mind of an entrepreneur, artist, athlete, academic to decipher what is the psychology of our decisions. I apologize for missing last week's volume, but I suppose with everything going on, I thought I could miss a couple of deadlines, and I hope you did the same. I arrived back from LA exactly a week ago, and I'm on day 6 of total isolation. I've not been running, but I've been yogaing, cooking, cleaning, and virtually catching up with people from all over the globe. Coming up on today's show, it's got everything to do with...
An NBC News employee dies after being diagnosed with coronavirus. Trevor Noah criticizes young spring breakers for partying amid the pandemic. And Disney releases Pixar's Onward on digital early so you can watch from home. First, an NBC News employee has died after being infected with the novel coronavirus. The network announced on Friday morning that the employee, Larry Edgeworth, worked in the equipment room at NBC's 30 Rockefeller Plaza office in Midtown Manhattan. The network said that Edgeworth also suffered from other health issues, according to his wife.
That was the news headlines exactly 6 days ago as I got off my flight and arrived in Brisbane. And also, I like how they are calling it the novel coronavirus. The coronavirus, or COVID-19, has, in a matter of months, transformed the entire world. Thousands of people have already died and hundreds of thousands more have fallen ill from a coronavirus that was previously unknown before appearing in the city of Wuhan in December 2019. For millions of others who have not caught the disease, their entire way of life has changed by it. In Italy, the most extensive travel restrictions are in place since World War II. In London, the normally bustling pubs, bars, and theaters have been closed and people have been told to stay in their homes. Worldwide, flights are being cancelled or turning around in mid-air as the aviation industry buckles. As industries, transport networks, and businesses have closed down, it has brought a sudden drop in carbon emissions. Compared with this time last year, levels of pollution in New York have reduced by nearly 50% because of measures to contain the virus. In China, emissions fell 25% at the start of the year as people were instructed to stay at home. Factories shut and coal use fell by 40% at China's 6th largest power plants since the last quarter of 2019. The proportions of days with good quality air was up 11.4% compared with the same time last year in 337 cities across China, according to its Ministry of Ecology and Environment. In Europe, satellite images show nitrogen dioxide emissions fading away over northern Italy. A similar story is playing out in Spain and the UK. Now, I'm not saying this is all a good thing, but I'm saying there are some positive things to look at, because just a few months ago we were worried about the environment and the planet. Today, we dissect what is going around the planet. This was a report released 3 hours ago on the 30th of March.
Back to our top story. Just 1 month after the U.S. reported its first COVID-19 death, America has become the epicenter of the pandemic. The death toll doubled in just 2 days, and America's top infectious disease specialist is now warning that millions of people face infection and 200,000 could die. Already, more than 136,000 people are infected, and more than 2,400 have died from the virus. Late today, President Trump sent a warning to Americans, saying the worst is yet to come.
The peak, the highest point of death rates, remember this, is likely to hit in 2 weeks. Nothing would be worse than declaring victory before the victory is won. That would be the greatest loss of all. Therefore, the next 2 weeks and during this period, it's very important that everyone strongly follow the guidelines, have to follow the guidelines.
The president announced today that he is extending federal guidelines for social distancing until April 30th to try to slow the spread. Jennifer Johnson has the latest.
America, now the world's epicenter of the pandemic. In another attempt to contain hotspots, the Centers for Disease Control has issued a new 14-day travel advisory for people in New York, New Jersey, and Connecticut, the states with more than half the country's infections and nearly half the deaths.
This is not a lockdown. It is a travel advisory. It's nothing that we haven't been doing, right? Non-essential people should stay at home.
So, we've been hit. There are a few things that I would like to cover before we move forward. Number one, the world as we know it and how we interact and do business is likely to change going forward. Now really isn't the time to suffer in the idealistic notion that everything will go back to the way it was. That is a psychological term called normalcy bias, the idea that everything will return back to normal. Two, journalism as a career for people was created for one reason and one reason alone, to report the truth. And today, more than ever, when we need the truth the most, we don't know who to believe and which version of the truth is correct.
How do you handle an epidemic in the age of fake news? There are the carefully orchestrated official messages.
I fully understand public concern.
Science-based, driven by expert advice.
Currently, the evidence from China, at least, would imply that children have much less of this disease.
Backed up by advertising and the mainstream media. But then there's the lies, rumours, theories that spread at speed around social media and the internet. A new challenge for governments treading the line between information, preparedness and panic.
You can never prevent people from panicking or from speculating about possible causes, particularly in health situations. However, I think that what we are seeing is a much more proactive stance from some of the social media companies compared to what we saw in response to disinformation in elections.
The battle against an infodemic is one the World Health Organization has been fighting. It has reportedly held meetings with tech groups like Facebook, Amazon and Airbnb about providing accurate information. Today, Facebook's founder pledged to act, offering free adverts to the WHO and saying they would remove false claims and block exploitative ads.
If the social media platforms can do this now, it does raise questions for their future about whether they are bringing themselves much more into the establishment, much more into the role of, say, a broadcaster that has to take responsibility for what's on their platforms and the effects that it has.
This nice lady reports about taking responsibility, while if I flicked through news channels and while I was writing this monologue, it was so extremely hard because I had to wade through piles and piles of horse shit like this, what Trevor Noah had to report a few days ago.
Donald J. Trump. Ever since this epidemic began, he's been desperate for it to miraculously resolve itself. Right? He downplayed its severity. He said it would vanish magically in April. And lately, he's been promoting the drug chloroquine as a miracle cure. Now, this drug hasn't actually been tested, and evidence of its benefits are still anecdotal. But because the president is out there promoting it every day, there has been a run on it. People are panicking and they're trying to get this drug because they think it can help. And the problem is that a lot of people with diseases like lupus and rheumatoid arthritis actually need this medication. And now there's a shortage and they can't get it. It's so frustrating, man. You know what we need to do with Donald Trump? The same way they bleep out curse words in rap videos, they need to start bleeping out Trump's misinformation at his press briefings. Yeah. As much as you want to blame Trump, we also have to ask ourselves how people are getting a prescription drug that they don't need. Yes, Trump is wrong for recommending this when he's not a doctor, but clearly there's some shady-ass real doctors out there who are putting people's lives at risk, and they should definitely know better than Donald Trump. Oh, and promoting unproven cures isn't the only sign that Donald Trump desperately wants to wish the coronavirus away. Because now Now he actually thinks we've done enough social distancing, and in his opinion, it's just time for everybody to get back to work.
America will again and soon be open for business, very soon, a lot sooner than 3 or 4 months that somebody was suggesting. A lot sooner. We cannot let the cure be worse than the problem itself. We're not going to let the cure be worse than the problem. Our country is not supposed to be, it's not built to shut down. Our people are full of vim and vigor and energy. They don't want to be locked into a house or an apartment or some space. It's not for our country. You can destroy a country this way by closing it down.
Psychology of entrepreneurship.
The main objective of this audio project is to bring together entrepreneurs and creatives who share similar values so that they can find the courage to put out their authentic voice for the right people to hear, which allows for them to make their impact on the world. Every great movement started with a memorable speech. For access to full-length interviews, go to psychologyofentrepreneurship.com and click the button. Ever since COVID-19 began to spread throughout the world, we've been surrounded by misinformation from a wide range of media platforms. From home remedies to conspiracy theories, in a time that already has us feeling stressed and uneasy, it's easy to be misled by your friend's Facebook post to try and put the situation into perspective and find some kind of comfort. But misinformation in the media is more common than you realise. In a study conducted by Professor Andrew Chadwick and Dr. Christian Vicari of Loughborough University, with over 2,000 participants in the UK, 42.8% of news sharers admitted to sharing inaccurate or false news, with 17.3% admitting to sharing news they thought was made up when they shared it. In an article by The Atlantic, they suggest following these steps when digesting or sharing information from social media. Consider the source and consider the source's source. Check your own biases, ask yourself if you're being constructive, and remember that anxiety is natural, but it's also viral. In a quote from public health expert Judson Brewer from an article in the Harvard Business Review, he states that when anxiety is spread by social contagion, defined as a spread from one person to another, it can lead to something even more problematic: panic.
It is so frustrating to get any dose of the news. If journalism doesn't give us the truth, then the whole industry is kind of pointless. There is no use for it. We watch movies about journalists that overcome great obstacles to bring us the truth, but I suppose the people paying their checks don't care about the truth. It's like a doctor not worrying about curing a patient, but on whether they're following procedure so that they don't get sued later on. Oh, wait, we're already here. Jokes aside, right now there are 723,319 corona cases worldwide. Of that, there's a total of 33,993 deaths and 151,804 that have recovered. Of the 185,797 cases that are closed, 82% of those have recovered and 18% of those have died. We were actually warned about this. We were warned about this a while ago. This is a Vox interview of Bill Gates 4 years ago.
Why don't you describe for me, as vividly as you can, what it is you're worried about, what it is that the nightmare scenario looks like?
Fortunately, there's very few things, and most of them are very low probability. Some big volcanic explosion, gigantic earthquake, asteroid. Well, at least in the nuclear case, you've got to say we take it quite seriously. We budget a lot of money, have a lot of people who think about nuclear deterrence, and I'm very glad that work's being done, and I rate the chance of a nuclear war in my lifetime as being fairly low. I rate the chance of a widespread epidemic far worse than Ebola in my lifetime is well over 50%.
So here's what's also interesting. There are patterns of this that happened in the past.
If we look at the 20th century and we look at the death chart of the 20th century, I think everybody would say, oh yeah, there must be a spike for World War I. Sure enough, there it is, like 25 million. And there must be a big spike for World War II, and there it is, it's like 65 million. But then you'll see this other spike that is as large as World War II right after World War I. And most people, a lot of people would say, well, what? What was that? There's two kinds of flus. There's flus that spread between humans very effectively, and there's flus that kill lots of people. And those two properties have only been combined into a widespread flu once in history. Well, that is Spanish flu.
Yesterday, the Prime Minister of the United Kingdom made this announcement.
Hi folks, I want to bring you up to speed with something that's happening today, which is that I've developed mild symptoms of the coronavirus. That's to say, a temperature and a persistent cough. And on the advice of the Chief Medical Officer, I've taken a test that has come out positive. So I am working from home, I'm self-isolating, and that's entirely the right thing to do.
And here is an ABC reporter talking about India's 21-day lockdown.
When India went into lockdown, borders were abruptly shut and transport came to a halt. Those far away from home had little choice but to walk.
For 2 days, the ration guys wouldn't give us any food, and we just had to go hungry.
In India, millions sleep wherever they can find work. With most industries shut down, the working poor lost their income and their bed. These men told me they're walking 240 kilometres to get home.
While I listened to India's 21-day lockdown and I listened to some of the people that are on the streets that live hand to mouth, which is the true sense of hand to mouth, they actually work today for money, which they go buy food and then they feed their families for today, and then they go back tomorrow and do the same thing over and over again. I feel really sorry for some of the people that make India great and make India function. Here is what I want you to hear more than anything else. You, listening right now, you have been preparing for this. You have been through tough times before, whether it was becoming a parent, losing a business, overcoming an illness. Only you know what you've been through. And you are stronger than everything else happening around you. And there are for sure people with much less options than the minor inconveniences we are all going through. In 2013, I lost everything but my wife of 3 months and my dog, Gabriel. $478,000 in debt, no business, no identity, and a long, long road back. At the time, I thought I was the only idiot who couldn't make a restaurant work, and I felt like my identity got stripped away from me. I worked really hard to make that restaurant a reality. I worked 7 days a week for years. Now, it's different. Whatever happens, however it happens, we will all be going through it together. And that is what I want you to remember. Please reach out if you need to talk. I'm here to hold space. You are not alone. And I want to leave you with this. This from Bill Gates' TED Talk, released on the 3rd of April, 2015.
We're not ready for the next epidemic. Let's look at Ebola. I'm sure all of you read about it in the newspaper. Lots of tough challenges. I followed it carefully through the case analysis tools we use to track polio eradication. And as you look at what went on, the problem wasn't that there was a system that didn't work well enough. The problem was that we didn't have a system at all. In fact, there are some pretty obvious key missing pieces.
And until next week, stay safe, connect with your people, and use your voice as a force for good. Much love.
Psychology of Entrepreneurship.
Coming up on the Psychology of Entrepreneurship.
You know, we as human beings, we are meant to go through life to learn. Funny thing is, I've never thought myself as anything else except the possibility of being an entrepreneur. Now I'm looking at all the stakeholders. So the stakeholders are not only the employees, but the families of the employees.
Psychology of entrepreneurship.
This is a Must Amplify production. Special thanks to every guest expert that has appeared on the show. Voiceovers, editing, and sound design by Kaylee Bonnyman. Guest research and content by Claire Gould and Corinne Castles. Project managed by Kaylee Bonnyman. Produced and hosted by me, Ronsley Vaz. For more episodes and where to listen, go to mustamplify.com/POE.
Hey, it's Kaylee from Must Amplify. I'm the sound engineer for this volume of Psychology of Entrepreneurship. I'm part of the team that made this production come alive. I work as a part of a global team with our studios based in West End, Brisbane, Australia. If you would like a podcasting checklist, email me at kaylee@amplifyagency.media. That's KAILI@amplifyagency.media. We specialize in finding your voice and making sure it's heard by the right people. If you are considering whether a podcast is a good idea for your business, check out our other show on shouldistartapodcast.com.